Hi, and welcome to the Division of Plastic Surgery at Stanford Healthcare. In this video, we will go over the general principles of breast reconstruction. In the past, breast reconstruction surgery was associated with high risks and inconsistent physical outcomes. Now, however, major advances in plastic surgery techniques and resources have reduced those risks dramatically. As a result, most women today choose to have their breasts reconstructed post-mastectomy. Here at Stanford Healthcare, our goal is to restore shape and function for those who have faced cancer.
Breast reconstruction may be performed immediately after mastectomy, or it can be done at a later time. For women who choose immediate reconstruction, the benefits are better cosmetic results, less scarring, and less surgery. Keep in mind, however, immediate reconstruction can possibly delay cancer treatment, or the cosmetic results may be compromised if you are undergoing radiation. If your cancer treatment involves radiation, immediate reconstruction carries higher risk since radiation affects the blood supply to the skin. It also increases the risk of complications. Often, the surface area of the breast volume also needs to be restored using tissue from another part of your body. Because of this, many women who undergo radiation therapy choose to delay their breast reconstruction. If you're currently smoking or have conditions such as high blood pressure, obesity, and diabetes, you may also need to delay your surgery. Your surgeon will discuss all your options with you and help you choose the best course for you.
Reconstruction generally involves either implants or using your own tissue. Each option has its own pros and cons. With implant-based reconstruction, the advantages are a quicker procedural time, a shorter recovery time, and you can choose the size of your breasts ultimately. Plus, there's only one operative site. The disadvantages are the lifespan of the implant is limited, and they typically last only 20 to 30 years. In addition, you will need to undergo more than one procedure, and revision surgeries may be necessary. For some patients, the implant can have an unnatural look or feel. There is also the risk for potential infection and capsular contracture, as well as other more rare complications.
If implants aren't for you, you may be able to use your own tissue to form the breasts in a procedure called autologous flap tissue reconstruction. In this procedure, we transfer the skin and fat, usually from your abdomen, thigh, or buttocks, to recreate your breasts. The advantages of using your own tissue are, it's from your own body, a more natural look and feel, improved abdominal contour. There are no implant complications, like having to replace them in 20 years, or risks such as capsular contracture. The disadvantages are, it's a longer procedure, a longer hospital stay and recovery, the risk of abdominal bulge or hernia, a second surgical site and additional scars, risk of damaged blood flow, and other complications such as blood clots or tissue loss.
A third option combines both your own tissue and usually an implant to recreate the breast. This procedure is called the latissimus flap implant reconstruction. We take the skin, fat, muscle, and blood vessels from the fatty part of your back and then transfer them to the chest. Usually there isn't enough tissue on the back to recreate the whole breast. Therefore, we supplement the lack of volume with an implant. The benefit of this procedure is that the blood vessels are never severed. They remain attached to the original blood supply in the back, so there's no need for microsurgery.
Depending on the location, type of tumor, and the shape or size of your breast, the nipple and areola may need to be removed with the breast tissue at the time of mastectomy. This is because the nipple contains ducts that carry the risk of developing breast cancer. At the end of your surgical procedures, the nipple and areola can be reconstructed with local flaps, grafts, tattooing, or a combination of these methods. Tattooing can also be used to restore the color and natural appearance to the nipple and areola. Keep in mind that while breast reconstruction rebuilds the shape of the breast, it doesn't restore sensation to the breast or nipple itself.
Here at Stanford Healthcare, we work with you as a team to tailor your reconstruction to your goals. We hope this video has been helpful in answering some of your questions about breast reconstruction. You can be assured that your options and expected outcomes are better than ever before. Here at Stanford Healthcare, you can also be assured that you'll be cared for by expert surgeons, compassionate nurses, and a professional staff. If you have any additional questions, please don't hesitate to contact us.